Trigger points are a local muscular spasm that can be felt as either tightness or pain, and are commonly found, for example, in the trapezius muscles, which are located right up here. There's many different ways to treat a trigger point. You can treat it with your hands. You can use spray and stretch techniques. I use a lot of dry needling, which is using an acupuncture needle to change the tissue tension around there. Sometimes we get a little a quick spasm and then a release of the tissue. And there's other, some people will use a needle, a regular needle, and inject things with it. I tend not, if I do the injections, I tend not to inject any steroids in there because steroids have been shown to weaken tissue and prevent healing. And the whole goal with everything that I do is to improve healing in the short term and in the long term. The trigger point release for some people can be very painful initially, but it can be so dramatic in reducing pain. I've noticed this especially in some of the glute muscles where people have hip pain or back pain, can't sleep at night, and this pain just seems to escalate as they go to bed at night. And if you treat these trigger points, that next night they're good. They're a little bit tight and not tender in the area, but mostly tight for about 24 hours, and then their pain changes dramatically. Typically, I use trigger points to help gauge what is going on in the tissue around it. So, for example, a trigger point may be an isolated event, or it can be a sign of weak ligaments, and so the muscles tighten and as a consequence to the increased motion that you have at a joint. And if you treat the trigger point, that works for the short term, but if they keep coming back, the key is to either rehab the area, for example, postural rehab exercises or PT can make a big difference, or you do a treatment with prolotherapy, PRP, or more advanced techniques to help improve the stability at the joint. Trigger points are covered by insurances, and that price may vary. I'd be happy to treat you or evaluate for these for any type of pain that you have. Thank you.